with Sieske of Autumn Animals. Sieske is a really passionate registered veterinary nurse, and she's the founder of Autumn Animals. So Autumn Animals is a veterinary hospice organisation who provide holistic support for pets and their families. Sieske has experience working as a vet nurse in the Netherlands and in climate change adaptation internationally. She's also an end-of-life doula for companion animals and is passionate about guiding families through the autumn of their pets' lives. She currently lives in London with her husband and super senior cat, Lewis. So thanks for joining me today.
Thanks so much for having me. So I just needed to say one thing. I'm not a registered veterinary nurse anymore, but I think that's something that we will come to in a bit anyway.
Sure, yeah. What made you move away from that?
Well, I was a veterinary nurse for about 8 years back home in the Netherlands, and I kind of knew immediately after graduating that it wasn't a career that I saw myself do for the rest of my life.
Yeah.
So that's why I kept on studying, and I became a climate change researcher. And after doing that for a few years, I did feel I really wanted to go back to working with animals again, but I always knew that I didn't want to go back into the clinical setting. Sure. So despite the fact that I currently run a veterinary clinic, it's a mobile clinic, so we don't have premises, but yeah, I think the clinical setting is it's not for me. So yeah, that's why I'm not a registered veterinary nurse anymore, but I have a lot of experience as a veterinary nurse and have been trained as one. Yeah.
Oh, okay, awesome. So you mentioned that it's mobile, so I bet a lot of cat owners really appreciate that. Going to the vets for some cats can be a bit stressful, kind of going in the carrier, going in the car, and being around lots of other animals if there's no kind of separate area, potentially, depending on the cat, obviously.
Yeah, and especially with the work that we're doing, it's mostly end of life care. So you know, our veterinarian and myself, we go to people's houses for what is often the last consultation they will have, and you, as a cat's guardian or cat owner, however you'd like to call yourself, it's nice to know that they didn't have to go through that stressful moment, that stressful journey going through to the veterinary clinic and being there, smelling all these weird smells, but just being in the comfort of their own home. And I've noticed, especially with the euthanasias that we've done with cats, is you know, they're just ready for it. That by the time that we arrive in their house, they don't mind that we shave a little bit of their front paw or like place an IV catheter to have access to their veins, because they're just in this, in their home environment, and they know it's all right.
Yeah, so in terms of euthanasia, some people may have experienced it already with their pet cat, or maybe they haven't. I was wondering if you wouldn't mind just kind of talking us through the process, because it might be scary for some people to think of what's going to happen. So if you could talk through the process, if that's okay.
Yeah, we're getting straight into it, aren't we?
Yeah.
So that's actually it's a really good question, because I find that most people are rather shocked by how nice the procedure actually can be. Because a lot of people call me and almost all of them say, oh, I prefer them to pass away in their sleep. And unfortunately, that is not something that happens a lot with animals, because they're so strong. Their bodies are so strong. And by the time that their heart gives out, their well-being and their quality of life has already degraded so much. So it's not really fair, I find personally, to let them wait until their organs shut down. So this is how I always explain how euthanasia goes. So we in terms of with cats, we always come to the house and we make sure that we first have a consultation. So we're there talking to the cat parents or the cat guardian, just to get the full story. We've already read up on their full story that their primary veterinarian has sent to us. And in that time, the cat can get used to us being there. So us, I mean, the veterinarian of Autumn Animals and myself. At the same time, before the consultation, I have sprayed myself with like pet remedy spray, so valerian spray or something like Feliway, so they can, they can feel calm with our presence. Pardon me. And once we all agree that euthanasia is the way to go forward, so both the cat's guardian and the veterinarian, they all agree, yeah, okay, this cat is really, really poorly or is really at the end of their life. It's good to go ahead and do the euthanasia. We then clip a little bit of fur from their front paws so that we can have access to one of their veins. We place an IV catheter, which is just, it's similar to what you would get into your hand before you go under general anesthetic if you've ever had surgery yourself. So we place an IV catheter into the front paw, and we tape that so that it can't move. And that is actually the most intrusive part, so to say, of the whole procedure, because I have to hold the cat and like make sure that they can't move their paw. But usually the cats are fine with just me holding them. We don't really restrict them. We just work where they are as well. We don't move them around. We just make sure that we can place that IV catheter in their paw. And once that has been done, we always give the cat guardians a little bit of time to just get used to that idea that, okay, now it's going to happen. And then the veterinarian will give the cat first injection through the IV catheter, which is a mix of pain relief and sedation. And that usually works really quickly because it goes straight into the veins. It takes a few minutes, maybe up to 10-15 minutes for it to work. But yeah, that's a sedative so that they will not be conscious anymore. And once that has worked, we will give the family some time to get used to this feeling. It's almost a little bit like they're under general anesthetic. So they're still there, they're still alive, but they're sleeping. And then once they are ready, we give them the final injection, which is a heavy dose of sedatives, which will make the heart stop working. And again, that usually takes just a few minutes for it to work. And in general, it goes really smoothly. So they go from sleeping to the heart stops working. What you sometimes see is that they will have a little bit of labored breathing, but that is literally just the body dealing with the drugs. It's not that they're conscious anymore. They're not feeling any pain or suffering anymore. And so once the heart has stopped, the veterinarian will make sure to listen, to really make sure that the heart has stopped, and then they declare the cat deceased. And then we remove the IV catheter and give the cat and cat's families their time to say their goodbyes, and really depending on what they've chosen for aftercare, so whether they want the cat to be cremated or whether they want to have the cat buried, we will take the body with us. So that is how the euthanasia procedure goes. Another thing that is important to say is as well, sometimes people are not really used to this idea, because what we see in the movies is that when a person dies, the eyes shut. And what actually happens is all the muscles in the body relax, so the eyes stay open. Which might look a little bit weird for some people, but we always try to explain that beforehand, that they know what to expect. Another thing that happens when muscles relax is that if they still have urine in their bladder, urine will come out. If they still have feces in their gastrointestinal tract, that will sometimes come out as well. But these are all things that you can expect beforehand, and we always talk people through the process beforehand so that they know what can happen and they're not shocked when it does happen.
Of course. I think that's really important. Really important part of it. So that's great to kind of, I mean, I imagine for a lot, I haven't experienced it yet, but for a lot of people quite anxiety inducing, I imagine. So kind of talking them through the different steps, I know that would make me feel a bit more
and also knowing that, also not knowing for a cat owner, it's not their sole decision. So when people call me to make an appointment, I always say, like, we come to your home for a hospice consultation. We'll take the drugs with us, so if it's needed, we will be able to use it. But we go there with the intention to have a conversation with the family, to have a look at the patient, and to then decide, okay, what is the best step going forward? So it's a qualified veterinary surgeon who will make the final decision. So people do not have to be afraid that they didn't make the right decision, or that they were playing for God, as like they were God or something. It's not that. It's a qualified person who will take that decision with you.
Of course, because cats are obviously a prey and predator species, so it's not ideal for them to look vulnerable. So they hide pain really well. In some cases. Could you mention any kind of guidance on spotting pain in cats?
I hope by now it's clear to many people that cats don't yelp, cats don't cry out when they're in pain. Unfortunately, we sometimes do experience people that think, oh, there's nothing going on, he's just getting older, he's just sleeping a lot. I think that is one of the, especially for older cats, is one of the points where you can say, he's sleeping a lot, there's something going on. I say he because my cats say he, so I'm used to talking in cats as he. If they are sleeping more, it means that they're not comfortable moving around more freely. Another thing that I noticed with my cat when, I think it was about 5 years ago, that we have this tower of boxes in our bedroom, like storage boxes, and he used to just jump up from the bed up to the boxes. And this morning I was just reading in bed and he was crawling up the boxes. So he was taking it step by step, just like on a staircase. Some cats take it step by step. And that is actually also an indication of they don't feel confident enough to make that jump anymore. And this is mostly all the cats that are, let's say, above 10. Sometimes it happens to younger cats as well. But it's a good indication of some kind of discomfort in their body, often musculoskeletal discomfort like osteoarthritis. But yet that showing of hesitation, when making jumps that they previously would really effortlessly be able to make. So it really depends as well on what kind of pain we're talking about. Do you have pain in their mouth? Sometimes you see a cat that's only chewing on one side, or like chewing in a really awkward way, tongue flipping out. That can be an indication of mouth pain. If, for instance, my cat has, so he's on a very extensive routine of pain management for osteoarthritis, chronic pancreatitis. If his acupuncture session, for instance, that is really relieving him of his osteoarthritic pain. If it's been too long between sessions, I notice that he starts grooming his knees much more. And my cat's white, so I see when he's grooming himself a lot, his fur turns orange. But with other cats, for instance, you would be able to see that they get more matting on their knees or on their hips. Matting can also be an indication. You see it often with cats that have matting on their hips because they're not able to clean their backsides anymore. That's also an indication of discomfort. What else was I thinking about? I noticed where my cat's hurting when he's a little bit funny. He does meow when he's in pain somewhere. So when I brush him every day, I think it's really important for like his skin and for his fur to be brushed every day. And also he really enjoys it. But I noticed that he's a little bit in discomfort when he's a little bit more sensitive in some spots. So he's perfectly fine with me being really rough with the brushing, but sometimes his hips are just a little bit more sore, and he does give me a meow.
Yeah.
And then obviously you have the archetypical cat signals of pain, which is showing aggression, hiding, you know, the people who don't really talk cats or who don't really understand cats think that this is a normal way of cat behavior, being showing the aggression or sleeping a lot, or you really acting out. That, I mean, that is often just a sign of discomfort.
I mean, that's why, you know, vet checks been quite right with the aggression and things like that. Sometimes, you know, if you're stroking your cat in a particular area and their eyes go really wide and their pupils dilate and then they lash out, sometimes it could be that they're in pain, they're constipated, you know, something simple like that. So yeah, you're quite right. I mean, just like us, we get more grumpy if I know I do, if I'm in pain or I'm, you know, cold, or, you know, I'm just less tolerant of things that I might normally be okay with.
Absolutely. So lashing out at each other as well, if they have siblings or if they have other cats in the house or other pets. Lashing out at each other can also be a sign of discomfort.
Yeah, absolutely. Yeah. So your boy Lewis, he's, how old is he?
He's 17.
17. Wow.
Yeah. He's still doing really well though. So
yeah,
really,
he's gorgeous.
Really
yeah. I didn't think he looked 17 when I saw him on the video. When so obviously, like I saw, I know as my grandma's getting older, she lived till she was 85. We obviously made adaptations to her house, and like she moved out of, you know, a house that had stairs. Well, in stages. So what kind of things have you done for Lewis to kind of optimize his home? Because like us all, we all need a bit of TLC and changes as we get older.
Absolutely, yeah. So I go around calling myself an animal occupational therapist.
Yeah, I love that. Yeah, it's so true, isn't it? Yeah.
There doesn't seem to be any animal or veterinary equivalent of it, and I think occupational therapy is what comes closest to it. So Lewis is a very lucky boy to live in this house where people don't go on holiday, people spend money on Lewis. So yeah, he for you see obviously the massive scratching post behind me. When we first moved into this house, he did use it completely. He used the floor bit and the ceiling bit. He doesn't go all the way up there anymore, but he does use everything up to, I would say, head height, so my head height. So that's about 170 centimeters. So he uses a scratching post vertically. So he scratches his nails vertically. But there are periods where he's just not able to stand up on his hind legs anymore. And that has to do with his osteoarthritis. And that's why I have horizontal scratching posts as well.
Nice.
You know, some cats prefer horizontally, some cats prefer vertically. And I think if you have an older cat or an aging cat, you would have to have both options, because it's also a good indication of how they're feeling, how their back's feeling. So this massive scratching post that goes from floor to ceiling has multiple beds attached to it. One of it is pointing, or is like next to the window, so he can go into this bed on the scratching post that looks out the window. And then there's the one behind me that's placed above the radiator, so all the heat from the radiator comes up to the scratching post, to the bed. Lewis has let me see, 1, 2, 3 steps up to the first bed, and then he can jump to the second bed himself. So that is the second part, I'd say, is get them steps. Asian cats need steps. They can't make those jumps, I'm sorry, I do see him sometimes make jumps of 1.5 meter high outside, because he still goes outside and jumps on over the fence. But he does tend to use steps in the house. So for instance, if he were to jump on the bed, he can jump straight onto the bed, but I do see that he prefers to take his steps. So we have little stools all over the house that he can use to jump on things. So, and also what I indicated before with the beds, there's heat underneath it. So the radiator is below it, the heat rises up to the cat bed, and he sometimes really likes to, I mean, all cats like to sleep in something warm, but it is really helpful for their joints to be kept warm. So sometimes I also use wheat bags on him when he's very sensitive on his back. Well, another one of those things that is really helpful for especially osteoarthritic animals is to raise the food and the water dishes. So he has like a raised set for water and food, and I know you don't know behavior-wise, it's not preferred to have water and food next to each other. Lewis is fortunately not such a picky drinker, so he does drink his water next to his meat, but we also have water availability elsewhere in the house. Let me see, what is another? I think one of the major things that we changed in our house when Lewis was getting a little bit more sore and stiff was having a rug in the house. So I am not a person that really likes rugs or carpet in the house, but we bought him how many meters? I think 3.5 by 3.5 meter large rug that is now in the middle of our house, because we noticed that he was not spending time in the lounge anymore. And he was sleeping a lot, and he wasn't spending time with us anymore. So I thought, it's not because he doesn't love us, because he still sleeps in the bed with us and he's very cuddly, but there's something in the lounge where he's not comfortable with. He wasn't playing anymore. He was still playing in the bedroom where we have carpet. So I thought, okay, he needs the rug. He needs to have grip, because he, like a slippery floor, he just doesn't have grip. So we got this rug, and he started coming back into the lounge again and actually playing. And he uses this rug to really like run around on still. So yeah, that is those are a few of the changes that we made in our home. In terms of his access to the outdoors, I'm not a big fan of cat flaps, because even though he can go in and out and other cats might not get in and out, it would cause him a little bit more stress. In our previous house, we had a cat flap, and it caused him quite a lot of stress. So he goes through the window, because we don't have a garden door. But on some days when he's just a little bit more sensitive, he shows me that he wants to get outside, but through the front door. So we have to actually walk him through the front door and through the building to get him outside. But that's a good way of him saying, like, I don't want to jump up and down. I want to just walk outside.
Observing kind of what he's saying to you through his
Well, it's not even body language. He just screams at us until we open up the doors. he's very clear in what he needs and wants.
That's what I like about cats. Do you have any tips if your cat has to rest? So for example, I saw a client a little while ago, her cat's okay, thankfully, but her cat got knocked over, so it had to have, the vet advised, it was a referral centre, it had to have an operation, crate rest. Do you have any tips on kind of what to do if your cat has to have crate rest, or wear a cone or anything like that, and isn't able maybe to groom themselves as easily?
Yeah, I think crate rest is if the veterinarian says crate rest, you need to do it, because those, especially if it's a matter of like metal pins in bones, that just needs to heal.
Yeah.
I would also then be really quick to get a physiotherapist involved, because I have found that veterinarians forget that to refer to physiotherapists or others, manual therapists. But if we were to have an accident, if we were to be hit by a bus and all our arms and legs are like in casts, we wouldn't be sent home like that either, and just be bound to your bed and not do anything. We would also get physiotherapy, because everything else needs to keep on moving, and muscles just need to keep on moving. And so that would be the second thing I would do: listen to the veterinarian, but also get a manual therapist involved, preferably somebody that's has trained as a physiotherapist. In terms of cones, I am not a big fan of the hard plastic cones, because it's just a bit awkward, to walk around with one of those cone of shames. And Lewis had a period a few years back where he kept on biting his back, and that was osteoarthritis and flea allergic dermatitis combination, where he was just constantly pulling out his hair, and just biting his skin. And we got one of those really nice blue soft cones.
Oh yeah, they're comfy cones.
So they can be going, like they point forward like a lampshade, but they can also point backwards, so they're like a cape. And that allowed him to still strut around with ease, but it also stopped him from licking himself. So it really depends on where the wound is, the reason why they need to wear a cone, whether you have to have it pointing forward or pointing backwards. Another thing that we found out then is, in his particular situation, a cape really helped. So for dogs, you have the brand Aquafleece. For dogs and horses, it's these jumpers made of fleece. But they also have, so they have jumpers, they have onesies, but they also have capes. So because obviously you don't want to wrestle a cat into a jumper, that's just silly. But a cape that would just go over his head, and then with a strap around the belly, and he wouldn't be able to lick himself or pull out his hair from his back. So that worked really well for Lewis. So it really depends on the kind of wounds that they have and what they're not allowed to touch, what option you would choose. I also saw these donuts a while back, even for cats, it's not a cone, it's just like a donut that goes around the neck. I think that would work with a dog. They said they're also good for cats, but I don't know, cats are quite flexible still, so I don't know. It really depends on your individual cats as well.
So thank you so much. Learned a lot. How can people find out more about you guys? I know you've got lots of blogs on your website.
So we have a lot of information on our website on www.autumnanimals.com. One of the things that I would really recommend is the listeners to do is the quality of life assessment we have on our website. It's free. I'm not collecting any data. I just want people to start doing quality of life assessments with their pets for as young as possible. So even if you just have a kitten, start doing a quality of life assessment now, and make it a habit that you do it every half year, for instance. With older cats or cats that have been diagnosed with a chronic illness, I would say do it more regularly, and do it with your whole family as well. So it's really important to start having these conversations, so that so having the conversations about what does quality of life mean for your family, but also what does it mean for this individual cat. For some cats, best quality of life means having access to the outdoors. For other cats, it's just being with their humans. So for every cat, that's really different, but it's really important to start having a quality of life discussion with your family now, so that when your cat does get sick or does get to an age where you're just not sure whether they're still having quality of life, you have already brought this up with your family and you can revert back to it and say, you know what, for instance, for Lewis, being able to be with his people is the most important thing, but the best pain relief is just not making it possible for him to be comfortable and sleep in our bed anymore. So that might be an indication for us that we need to start thinking about letting him go, for instance, because pain relief is just not cutting it anymore.
Yeah.
So yeah, that is one of the resources that I have on the Autumn Animals website. We have loads of blogs on there as well, on the website, and we have an Instagram account, and that's called Autumn Animals London. So a lot of the information that we have on the website, you can find that on Instagram as well in a little bit more bite-sized snippets or chunks. Obviously, we also have a LinkedIn page and a Facebook page. So it's all Autumn Animals London, and it's easy to find.
Brilliant. Yeah, I'll pop links to all of those within the
Amazing.
show notes. So if anyone wants to have a look at those and find out more, then please have a look. Yeah, thank you so much. If anybody has any questions, are you happy to, depending on what they are, obviously, happy to answer them? Yeah.
Absolutely. So on my website, there's also a link to our Calendly page. So Calendly is like a booking program. If people want to have a free exploratory chat about how I can help, or maybe want some sort of advice on making environmental adjustments or how to talk to their vet about certain worries they have, they can just book a free chat with me through the website, and I'm happy to help.
Perfect, thank you. What areas do you cover?
Well, at the moment we're in London, so we cover the whole of London.
Whole of London.
But for a lot of advice, I do nationally, internationally, so I can do quite a lot virtually. But for the home visits, we cover the whole of London. But we're coming to the southwest of the UK soon.
Okay.
Yeah.
Great. Well, thank you so much.
You're welcome.
Yeah, take care.
Thank you so much for having me.